Welcome back, everyone, to our Unclenched podcast. Today, we are going to be talking to Dr. Nicole Czech. Dr. Nicole is an upper cervical chiropractor that I work frequently with. Together, I'm very proud to say, we have brought relief to many patients. At the end of the podcast, we will answer a couple of questions from you, the listeners. Before we get started, though, I need to get caught up with my Alex. How have you been? What's new? Is there a patient story you want to share with us?
There is a patient story, and what's new is just a lot of the same, working. Danielle at my office is getting ready to have a baby. So we were looking for somebody to fill her position, which nobody can fill her position, but just help us through. Help us get through, until she's back from her pregnancy leave. So that's exciting. I'm excited to see her baby. I can't wait. I hope next time I can let you know that everything went great, and that's what we're praying. But that's exciting for us at the office.
Yeah.
But I had a patient that came in, Priya, this past week, and she was from Virginia, and she had cervical torticollis. Have you ever treated anybody with cervical torticollis?
No.
Okay. So I've treated a few patients and I've had great success. And her neck just always wants to pull to the one side. And she had 2 appliances made from a doctor down in Virginia. And one was an Alpha appliance and one was a Gelb appliance. And she wore both of those appliances. So when I saw her, I'm like, "Oy, okay." But the funny thing was, or not funny, but something that was extremely eye-opening to her. And we took a side photo of her, just like turning to the side without any appliance, to see the curvature of her neck and her head posture. And she had a little bit of forward head posture. And then I had Danielle put both appliances in that she wore the majority of the time and take that same photo. And the amount of more forward head posture, it's like her head was going to come in the room before the rest of her body, was amazing. And she's like, "Oh my gosh." I said, "You're coming more forward, something with that appliance. You're coming forward maybe to get more air and, because you're not breathing well or taking in the air." And she's like, some of her TMD things got better, but never her cervical torticollis. So I can't wait. She's coming back up this week so I can take a bite and get her some type of orthotic made for her and get records and everything like that. So I am so excited because I have such a good feeling about this. And like, you've been doing it so long. I'm like, I know exactly where I want you to go. But of course, we have the instrumentation to lead us there and verify everything. And nothing is done by the eye. Everything is done by data. So so it was so interesting. And it was just extremely eye-opening to see. And we always talk about, like, an appliance can be good for you, an appliance can be harmful to you. And I think in her case, the appliances are harmful. And her husband was there looking, he's like, "I cannot believe this." And I said, "It doesn't." And we didn't tell her to do anything differently. We just started patients inhale and exhale. And on the exhales when we take the picture. And so put the appliances, inhale, exhale. Unbelievable. I got to get permission to use her pictures, like in, lectures or what have you. But I just met her for the first time. I didn't want to really
overwhelm her.
Oh my God, this is what we need. I got to show everybody this.
If you got permission, you could also get permission to use it on social media, because I feel like our patients or like our followers would want to see that.
Right. And most of the people that are our patients want to tell their story or help in any way they can to help somebody out there that has been suffering through all of this and stuff too. And oh my God, the doctors, the this, that, unbelievable. So I'm like really excited to see her again.
Good. I bet you are. Yeah. That's so cool.
Yeah. So how about you?
Yeah, busy with the kids, busy with so much going on, all the time. But it's fun. They're at such a fun age that it's like more fun than it is work because they're 7 and 9, right? So it's like, at 2 and 4, it's more work
Yeah.
than it is fun. Like,
Yeah.
right?
Yeah.
So now it's more fun than it is work, and it's so just we got a puppy.
Oh
Was
my
that
gosh, what
necessary?
kind of
No.
puppy?
It's insane here. She's a doxy mix.
So
And
what doxy mix, like, what's the mix?
I don't know. I tried to send something to Embarked, and I think it was a big scam. Like I sent them a DNA sample, and I heard nothing back ever. So who knows? We got her at the
Oh my
vet,
gosh.
but she is 11 pounds, and she is a little wiener dog, but she's a long-haired one. So she has these like fluffy ears that like flop around when she runs, and
Yeah.
she's very dominant. So that's interesting. I don't know how to
Yeah.
train puppies, but luckily my husband does. So we have her. So that's the new thing at home. And then a patient that stands out, there
That's
was a
the same
patient.
before you get to that, that's the same kind of dog that Ashley wants. She wants a long-haired hot dog.
Oh my gosh, she is so cute. I just like look at her and melt, even though
Yeah.
she's a terror. She's
Yeah.
insane.
Yeah.
And she thinks she's dominant. She's alpha. Like, this is her house. She's in charge. She has to protect us. And like, thank God my husband knows how to like train dogs
Yeah.
because this one's crazy, but she's so cute.
Yeah. Yeah.
So cute.
Good.
But yeah, a patient that stood out to me is one recently where like she was feeling relief from her orthotic, but I don't think she realized how much relief, because it's a hard thing to gauge.
Mhm.
It's like when you live with someone and they lose weight. Like, you see them every day, but then someone that hasn't seen them in like a year is like, oh my God, you lost a lot of weight,
Right.
right? So
Sure.
it was kind of like that, but she ended up losing the orthotic, unfortunately. Like, I don't know exactly what happened, but she didn't have it. And suddenly, like, all her symptoms were back. So she was like, oh my God, this was helping
Right.
so much. So it's like the silver lining on losing an orthotic is like you realize how much it's helping. Like, it sucks to lose
Right.
it. But
Sure.
so that was kind of an interesting realization for her, I think. So yeah, that's kind of what is at the top of my
Yeah.
mind. But yeah,
Yeah.
let's bring Dr. Nicole on. Dr.
Okay.
Nicole Czech received her doctorate in chiropractic from Life University outside of Atlanta, Georgia, after getting her undergraduate degrees in health sciences and public health from Carroll College in Helena, Montana, which is the
Oh,
capital.
well.
Welcome, Dr. Nicole.
Hello, thank you so much for having me.
Oh, so nice to meet you, Dr. Nicole. But before we get started, everybody starts in their profession by something. And so what was your journey? And I believe you suffered from headaches, and that's what set you kind of on this path. So tell us a little bit about your upper cervical chiropractic care and how that all happened.
Absolutely. So I have a history of pretty much headaches from childhood on. They were sporadic, and then all of a sudden at the age of 12, they hit one day. It was headaches, migraines every single day. So my parents tried everything, the traditional Western medicine. We were going to neurologists. We were trying naturopathic medicine. We were trying acupuncture and diet and all these different changes, including also traditional chiropractic, and nothing was changing. It was just status quo. And it was something where my parents heard about an upper cervical chiropractor that was about an hour away from us. And they were like, what do we have to lose? We have nothing at this point to lose. So they took me, and within two adjustments of my atlas bone, it was the first time in a year that I didn't have a headache or a migraine. So with that experience, it was just this profoundly life-changing experience to go from constant chronic kind of pain to being pain-free, that I was like, well, I think this is what I meant to do with my life.
Wow.
Love that.
So can you tell us like the difference between upper cervical chiropractic and traditional chiropractic care?
Absolutely. So, traditional chiropractic care, people usually think of kind of the big pop, twist, crack kind of chiropractors.
Yeah.
They're doing a lot of manual work with their hands. It's kind of, a lot of people perceive it as being like rough or really forceful. And especially for someone who's guarded in their neck or someone
Mhm.
who has a lot of pain, it's something where it can be a little bit too much or they're really sensitive to it. So upper cervical is a little bit different because upper cervical chiropractic care, it's something where it's very detail oriented. It's very, very focused on what's happening between the occiput, the atlas, and the axis, and how that influences the rest of the body there. So, that upper cervical chiropractic care is focusing on teeny tiny little measurements and movements in order to get the atlas bone into a neutral position.
Wow.
Well, with all of this, can you talk a little bit about the connection between the neck and the jaw and like what do you learn about this connection in depth in school or when you're learning the upper cervical part? Like how does the jaw, I guess, fit into all of this?
Yeah. I was lucky enough, the school that I went to, we were able to learn about jaw mechanism as we were in school. So I would say we're very, very lucky that we did get to learn that. But in terms of connecting it with upper cervical spine, some of it comes from upper cervical teachings. A lot of it comes from just taking a bunch of different coursework. So I have taken several different coursework in upper cervical techniques, and then also did a little bit of other coursework as well to learn about jaw and other treatment mechanisms of how that can be helpful and progress in these headache, migraine, and jaw cases.
So, and kind of to backtrack a little bit,
Yeah.
what is your earliest memory of a headache? How old were you?
Oh gosh. I think earliest that I definitely know I had a headache, it was probably about 6 or 7 years old.
So it's interesting because Dr. Sutter, I know I'm going off script here, sorry guys, but Dr. Sutter talks, Ben Sutter, he's a dentist in Eugene. He talks a lot about how the teeth coming together impacts headaches, like our occlusion, our bite can make the muscles so mad that we start to have headaches. And so 6 or 7 is exactly when we get our first um,
Molars.
our first molars. Yeah. And so he was talking about how a lot of people experience headaches around that time if they erupt in a pattern that makes the muscles inflamed. So I've never asked you this, Nicole, because Nicole and I are buddies. I'm not going to lie. We're like besties, but I've never asked you like how early it goes back. So very interesting to hear that it's that age.
Absolutely.
Yeah.
Hmm.
Yeah.
Hmm.
How do you determine whether someone actually needs an upper cervical adjustment or will benefit from it?
Yeah, a lot of it is taking on their case history, figuring out what they have going on, number one. But then we look for certain things. So it might be something where we look at them and we're doing an exam and they have really, really tight muscles in that kind of base of the skull area. Their scaling muscles are incredibly tight. You see where the traps are just bound up. And, a lot of people complain of, I have these trigger points. I have these knots I keep ripping out in my shoulders, and they just don't go away. They just come back after an hour, even after a deep tissue massage. But we look for the kind of inflammation, we look for muscle spasm, we even look for different kind of abnormal movement patterns. So we might see that their range of motion is really restricted one direction or all directions. They can't look down, they can't look up, they can't tip side to side, or even checking those blind spots, turning left and right is really difficult. So
Interesting.
putting all of those things together, but also taking a look at the body as a whole. So a lot of times we'll see where there's a shoulder that's higher than the other. We can see where one leg actually draws shorter than the other when they're laying down. And it's something where it's not necessarily a pelvic issue. It could be something that's referring from that upper cervical spine.
Well,
Yeah.
who is not a good candidate for the upper cervical adjustments?
It's we have caught a few cases where we have had patients who have had non-union of the dens of C2 to the body of C2. So it's something where anyone
Ah.
with major instability, it's also something where anyone with surgical
Oh,
artifacts,
sure.
especially in that upper cervical spine. So we see that mostly in a lot of Chiari cases.
I was going to
So
ask, Carrie.
where where they have to do surgery for opening up space for that Chiari. But and otherwise, sometimes if it's really, really, really degenerated in that upper cervical spine,
Mhm.
if we see a huge amount of degeneration, we probably don't want to irritate it by touching it. But it's what I love about it is it's super safe. It's the youngest atlas I've adjusted is someone at 2 weeks old. The oldest I've adjusted is about, I want to say 92.
Wow.
Nice.
I
Nice.
wish I had known you when Serena was born. Like, Dr. Alex, you're sick of me talking about my kids, I'm sure, but
No,
like,
I'm not.
I know, but it like breaks my heart that I didn't have the knowledge that I have now. Like, she was so colicky.
Well,
She was so
trust me. I've been there, done that. I get that. But you know what? You gotta move on.
I
Yeah.
can't. Dr.
Let it
Alex, I'm
go, sister.
in therapy. So, is there a common pattern you see with TMJ patients in terms of their neck alignment specifically?
I wish I could say yes,
That's
because necks are
okay.
so individual. It's in terms of the patterns that we kind of look for, I can't pick out one thing that's very common with them. The biggest thing that I see is a lot of what I like to call the chicken neck. So where people are sitting there and their head
Yes.
just dives forward and
Yes.
it looks like they're almost pecking like a chicken.
Yes.
And part of that can be airway, trying to open up that airway, and part of it can even be that kind of almost protective. They're rounded forward, that head's coming
Mhm.
forward. They're so guarded in this position, but that puts so much strain on that upper neck. It puts so much strain on those poor little jaw muscles
Yeah.
that it can be really detrimental.
Yeah, yeah, no, I'm
Yeah.
sure, like well, what's so interesting is that, like, Dr. Alex and I talk a lot about forward head posture and breathing and airway and, physical therapy and upper cervical chiropractic and how that's all related to TMD and jaw locking, so it's interesting that you also say, like, the forward head or that chicken posture is like what you see commonly. So let's talk a little bit about a patient we've had a lot of success with. So I asked Meredith in advance, and she said we can use her first name in this episode. When she came to see me, she had constant jaw pain. Her left jaw joint felt really unstable, constant clicking in this left side, and she had neck pain too. So with my treatment, we were able to resolve her jaw pain. We got her jaw feeling a lot more stable, and we decreased the noise in this left joint significantly. But we didn't really have a huge impact on her neck pain. So I encouraged her to see you for a while before she made the leap to go and see you. She was like, I just don't know. Like, I don't know if I want to do that or not. And but then once she started her treatment, she began noticing an immediate difference. And she's just like, yeah, like use me, tell them my story. Like people need to know that there's such a connection. So what did you do for her neck specifically? And she also mentioned that more recently, and I've been meaning to talk to you about this in person, how you took a course and it taught you about adjusting the scalp, the cranial bones, and which actually she noticed a big change. She said it helped her even more. So she's like 95% better. Those are her words, not mine. So can you talk a little bit about what you did for her neck, the scalp adjustments? Yeah.
Yeah. So we were able to check her out, see what's going on. We figured out from taking x-rays in our office of the cervical spine exactly how we needed to address that atlas bone. And she responded really well to that, but she was still coming back with complaints. She was still like, it still doesn't feel quite right. I still am getting that that frequent neck kind of symptom. And so we started kind of diving into, okay, what else? And we were kind of chatting about it. I had just taken a course in that was talking about jaw and talking jaw about jaw in a very different kind of way, treating it like an extremity. So it's something where even though jaw's attached to your skull, it doesn't move like skull bones. We have to treat it very much like its own thing, but talking about the influence of the skull on the jaw, but also all the soft tissue around the jaw as well. So it was really neat because I was like, okay, Meredith, if you're open to trying something new, I've never tried this with a jaw patient before, but if you're willing to be the guinea pig, let's try this approach of what I've learned. And so we started doing a little bit of adjusting of the kind of side cranial bones here and the back cranial bone right here, And that really helped. It really helped get movement there. The other thing that we did was just focusing on the muscle right underneath the chin there and actually testing it. So just doing a little bit of trigger point as she's opening and closing her jaw and figuring out, okay, if we press here, if we apply pressure here, does it stop the clicking? Does it stop the popping in the joint? And so for her, she has a spot, it's almost like right underneath the chin right here. And we can do a little bit of an instrument adjustment, just a little bit of stimulus right here. And it's like it completely takes away all clicking, all popping in that jaw, which just helps her neck do so much better.
Well, it's so crazy because after she started seeing you, her clicking and popping went down even more. Like I was convinced we had reached a plateau. I was like, this is as best as we can get you because taking away a single click or pop is the hardest thing. It's actually easier for me to get a jaw unlocked than to take away a single click or pop. And so when she started seeing you and I saw it decreasing and she said she was feeling better and it was like the perfect combo for her, like I was just like happily blown away. I was like, this is great.
Well, when you were saying where you were adjusting here, are you like above the hyoid bone? Was it something with the the like myohyoid muscle? Like what were you actually doing?
Yeah, it's so above that hyoid bone through the kind of the muscle belly right underneath the chin here, and just finding, whether it's a little bit of kind of platysma that's also there that gets
Mhm,
involved, but doing just a little bit of a instrument impulse in the muscle
Mhm,
itself,
mhm.
and it's like it just unlocks it just like that.
so is that something that's going to then, like, is that a forever thing, or is that something that's gonna tighten up when those muscles tighten up?
It's really neat. I've actually seen with Meredith that it's having this lasting impact. It's not as tight when she comes in. It's something where once we start adding this in, even this last time that I just saw her, it was really neat because we could barely find it if we applied pressure. It's something where she barely had any clicking, popping, and there was
Mhm,
barely any tenderness in that area. It was like, wow, we're really close to not even having to do this kind of adjustment, this kind of
mhm.
work when she's here. So it does seem like it's propelling her towards not needing that kind of adjustment in the future.
Interesting, interesting.
Mhm. So, Dr. Nicole, can you talk about the different upper cervical chiropractic techniques like Atlas orthogonal versus Nuka versus Blair, et cetera, and let us know a little about how they differ from each other? Because I get this question a lot from my patients.
Yeah. So each of them have their different kind of approach to the analysis. So everyone is just that little bit different. In terms of Blair and Nuka, what I know of them is they are hand adjustments. So they are adjusting the atlas on I believe the table has a drop away. So the table headpiece drops away that little bit. And the kind of hand of the chiropractor is just behind the ear here, where there's a couple different ones like Atlas orthogonal, what I practice, but also orthospinology that utilizes an instrument. So instead of using the hand, the table's a lot higher, it's a lot taller. And instead of using the hand, we have this instrument that's usually table mounted, and it has this arm that swings just behind. So it's like a little stylus, like a little pen that is just touching just behind the ear here. And people hear just like, it's almost like a pen click. It's a very, very just soft sound. You don't really feel much of the adjustment at all. So, especially people who are even cautious of the manual adjusting. This is something where the upper cervical approaches are super, super gentle. It's not a forceful, big kind of adjustment. And so, even comparatively to some of the others, there's some instrument based. So, if you don't want any hand adjusting, if you just purely like instruments, gadgets, things like that, that's where your advanced orthogonal, atlas orthogonal, your orthospinology is great. Otherwise, if you're open to hand adjusting, there's Nuka, there's Blair that are also fantastic too.
So, whenever you're adjusting, do you take any kind of x-rays to measure angles and to see if, like, yeah, that adjustment was good or anything like that?
Yeah. We used to take them after every single first adjustment that we ever did. And
Okay.
it's something where actually we started backing off of doing it just because we were exposing our patients to more radiation. And a lot of times we were seeing the improvement, but it was kind of like, well, we see improvement. We're not changing anything with the way that we approach our treatment, but we're exposing them to more radiation. So it's something where in my office, we started to just hold off a little bit, and if they're not progressing within a few adjustments, that's when we take that
Got it.
kind of other x-ray and go, okay, well, what's different? What's changing here? What might we need to do a little bit differently to keep them progressing?
But to be clear, you take preliminary x-rays.
Sure.
Absolutely.
Yeah.
Yes.
Okay.
So when do you find, I have a couple questions. So when do you find yourself referring to Priya first?
A lot of times we'll kind of co-treat. Patients will want to start care. We start treating, and I make the referral of like, hey, I think you need to go get checked out. I
Hmm.
would evaluate for this. I would look at this, especially since it's impacting you so much.
Hmm.
And so it's something where a lot of it really goes hand in hand. If I
Hmm.
see someone who's truly like they are lock closed, I had one person who walked in going, "What do I do?" And I was like, "Well, here's Priya's pamphlet. Walk right across the street. I want you to go see her." And they did. They did go immediately over to talk about getting scheduled. So it's if someone's extremely locked closed and it's like, okay, we need to get you emergency wise into someone soon so you can function again. That's when
Hmm.
I do that kind of immediate referral.
Hmm. So what are the most common symptoms that people say I need this chiropractor for?
A lot of times it's like that nagging persistent headache where it comes on every day, or it's something where it's like it just doesn't go away. It's this underlying low level headache that's always there. Otherwise, a lot of it is just, I'm stiff all the time. I don't feel like myself. My head's always foggy. I wake up tired all the time. And it's a lot of that is what I see, even overlapping with both headache and those jaw patients.
Hmm.
The brain fog is like a real thing.
Hmm.
Oh,
Yeah.
for
And I
sure.
And I think a lot of times it's especially the females, perimenopausal females, they're getting told, well, your brain fog is all perimenopause. It's all your hormones.
Mm.
And patients come in and I start, just checking, how are you feeling? How are you doing? And they're like, my brain fog's gone, but I'm still perimenopausal, so I don't get it. My brain fog's gone, but and it's like, well, what
Mhm.
if what if your brain fog was never actually perimenopause? What if it was actually a neck problem?
Yeah.
Yeah, I hate when they blame things on stress and hormones. Like I'm
Yep.
like, blah.
Yep.
No.
Yeah.
Oh my
There
gosh.
can be like structural, functional things going on that are not being addressed, right? So it's like
Mhm.
it's so easy to blame it on hormones, and it might be
Right.
Yes.
that might be
And
like
stress.
a factor, yeah, but or
And
stress, right?
Yeah,
It
yeah,
might be a factor, but it's usually not the root cause. Like it adds on to
agreed.
things getting worse, right?
Agreed.
Um,
mhm.
can you talk, Dr. Nicole, a little bit about the postural chain, like how the shoulders or spine being off, asymmetrical, imbalanced, curved, how this can then affect the hips, the feet, the gait, the jaw, like everything, the neck?
Absolutely. So the other day I was trying to come up with a way to explain the atlas and how it affects everything that would make sense for a younger patient. And we started talking about, okay, boiled eggs. If you're eating a boiled egg and you have an egg cup, your atlas bone is like that egg cup. So if you take that egg cup and you put it at an angle, if you start tipping it over, what's going to happen to that egg? And they're like, oh, well, the egg's going to have to swivel in place. And it's like, well, that's what your head's doing. And they were like,
Ooh.
oh, okay. But then if you think about it, so then the head starts swiveling. What's that going to do in triggering the rest of the body? So
Mm-hmm.
typically we'll see one shoulder starts drawing up a lot higher. We
Sure.
can
Yeah.
see where it starts affecting the mid back starts getting really tight. Then it's like, oh, I'm laying here, my hips are uncomfortable. We're seeing that one hip starts to draw up higher too. And then by that hip drawing up higher, that kind of body responding, it'll draw one leg shorter. And we're not
Mhm.
going, hey, anatomically, these bones are shorter in your leg. We're going based off of this kind of compensation that's happening up there at the upper neck. It's creating this functional short leg. So you're walking around and it's putting a lot more stress on that low back there. It's putting a lot more stress on the inner knee. You might see a little bit more pronation of that foot there. But even if you take that head and you take someone's skull and you tip it to the side and go, okay, if your head's tipped to the side, I want you to chew, I want you to talk, I want you to breathe, I want you to swallow all this way. What's it going to do to all the muscles that are there? And then people start going, oh, that would make sense. Why, if I have this neck misalignment and this jaw, it starts kind of fighting with each other. So the more that we can just take that interference out of it, the more that we can allow that body to stack correctly,
Mhm.
it's going to allow the shoulders to stack a little bit more correctly. It's going to take a huge amount of stress off of the pelvis. It's going to allow for those legs to balance so then it doesn't feel like you're walking around jamming your kind of your hips, your low back just by moving around. And
Yeah.
it's not having this kind of feed forward effect into the jaw and into the neck itself.
Wow. Wow. Great. Well, thank you so much, Dr. Nicole. We've learned a lot from you, and I'm sure our viewers and listeners have also learned a lot. So let's take a couple questions now. And here's a good one. Good for you. How do I find an upper cervical chiropractor in my area?
There are a few websites where if you search upper cervical chiropractors, they'll pop up and you can find kind of a library of upper cervical chiropractors. Otherwise, if you're familiar, if you start searching, Blair chiropractors near me, Nuka chiropractors near me, Atlas orthogonal chiropractors near me, those kind of words, those phrases, or upper cervical chiropractors near me in this city, they'll pop up. And so if you kind of look for those buzzwords, look for those websites, you can find them.
I love
Good.
that. My brother-in-law, I was trying to convince him to come up here for his migraines, and they live in SoCal, and he was just like, "I can't do it. My kids are so young. Da da da. Who can I see here?" Because I wanted him to see you, and he found a Blair chiropractor, and it helped his headaches so much. And he had tried everything. He had tried
Hmm.
PT, acupuncture. I made him orthotics. Like he had literally tried everything, and he was just like, I am dying. Like I'm so uncomfortable.
Aw.
And the Blair chiropractic is what helped him the most. And so yeah, I mean, upper cervical, I'm such a big fan and believer. Like Dr. Nicole helped me when I had whiplash and I could barely move my head, and her adjustments helped so much. So another question, do all TMJ patients have to see an upper cervical chiropractor? Like, what are your thoughts on that?
No, there are some people that come in and honestly, their necks feel great. It's we start checking it out and it's like they don't have anything that would really indicate or show that we need to perform any sort of adjustment. So for some people, it's not warranted. So it's something where, I always take the stance in my office is if I see someone and I don't think I can help them, I try and get them to the next person that can. So
Yeah,
it's something where if it's not going to be an upper cervical issue, I'd rather get those people to, where they need to be.
wonderful.
Yeah, well,
Well,
that I think that's what we do too, like,
yeah.
Yeah.
or we can only get them so much and then we need something else. And a lot of times we don't, but sometimes, you just want to go that extra step and we can't be everything to everybody. And
Hmm.
you've got to know when to pull in another kind of practitioner, if you
It's
will.
Yeah.
it's it's tricky too because it's like based off of like one assessment, two assessments, like a CBCT, some X-rays, whatever. You don't always know how the body's going to react, right? Like, so I have given people an orthotic, convinced that I'm going to send them to Dr. Nicole in like 4 or 5 weeks. And they come back and like all their neck pain is gone. They're feeling wonderful. They're like, oh my God, I'm so glad. And then there's been other people where I think, okay, like I can help them with the majority of things, but then one thing persists. So I'm like,
Right.
okay, I'll
We'll
send them
find
to
you
Dr. Nicole.
somebody. Yeah.
Yeah.
Right. So it's hard to know at the beginning because TMD can be such a full body thing. And like the neck and the jaw are like this. So Dr. Rahman really calls it cranio-cervical. What does he call it? Cranio-cervical mandibular disorder, CCMD. It's not just TMD. It's the neck, it's the jaw, it's everything that comes together. So anyway, I'm like doing a TED talk. Sorry, but Dr. Nicole, thank you so much for being with us. Please let the audience know how they can find you. Are you on social media? Do you like your website? Just share everything.
Yeah. So clinic website, ASC Vancouver.com, Atlas Spinal Care in Vancouver, Washington. We have an Instagram page. It's ASC Vancouver. And then my Instagram page is Dr. Nicole Czech. So just my name. You can find me on Instagram, and I kind of show my still progress with my headaches because it's an ever evolving kind of thing. But I do have to kind of tip my hat to Dr. Mystery because she's helped me through a car accident and now with some apnea kind of things going on. And so it's something where it wasn't fixed by upper cervical alone. That team approach is incredibly, incredibly helpful. So I'm so thankful for Dr. Mystery and her work as well.
Well, thank you so much for taking the time to be with
Thank
us. We appreciate your knowledge and sharing with us, and it was nice to meet you.
Nice meeting you. Thank you so much again, and have a wonderful weekend.